We're going to talk about self-concept. As Dr. Seuss would say, today you are you, that's truer than true. There's no one alive who is newer than you. So what exactly is self-concept? First of all, it's very subjective. It's a mixture of unconscious and conscious thoughts, attitudes, and perceptions. Why is this important? View of yourself, why is it important? It's a mental image. Because it affects your self-esteem. Our sense of self evolves throughout life. What you think as a teenager about yourself is not what you're going to think as a 50-something-year-old about yourself. And most importantly, if you understand the patient's self-concept can help guide your nursing care for that patient. Factors influencing self-concept. An individual's perception of the factor will determine their response. So, in other words, what you see, what you believe the stressor is the most important factor in determining your response. For example, somebody could get a B on a test, and their response is, oh my God, I didn't get an A, I'm not that smart. That's their perception. Where another person can get a B on a test and be, oh my God, thank God I got a B on that test. It's less points that I have to worry about at the end of the semester. And that's their perception. So how your response is your perception. Changes that occur in physical, spiritual, emotional, sexual, familial, or sociocultural health. When we have changes on either of these things, we need the ability to reestablish balance in our life following the stressor. The factors included in that are the number of stressors that are going on, the duration of the stressors, and your health status. A crisis is when a person needs supportive and educational resources to help learn new ways of coping with responding to the stressful event or situation that they can't get under control to maintain or enhance their self-concept. Perceptions. There's a couple types of perceptions. Self-perceptions, obviously, how you see others and how you see the world around yourself. And education and experiences influence your own self-perception. Perception of others is by looking at others. A lot of times we use stereotypes, whether we realize it or not. Our emotional state at the time, we're upset about flunking a test. You might be angry with the teacher. And perceiving others' messages. Sometimes we don't always understand what people mean. We perceive it in our own way. A good example of that is email. You can't read intonation in email, so you may perceive a message that is not necessarily negative as negative. But that's your own self-perceiving what the other person thinks. So culture, obviously it's one of the biggest influences of self-concept because it involves your family history, what kind of culture you're brought up with, and the experiences that are undergone in regards to that culture. Everybody has a little bit of different family history and cultural events that have gone on in their life that influence self-concept. View of health, another concept that we need to incorporate. So your own view of health affects your self-concept. Again, this has shaped things like education, where we live, media, government policy, and family upbringing. I've gone to places where a person was in terrible health, you know, COPD, laying on the couch, have on dialysis, and they just think it's fine. It's just amazing to me that they perceive themselves as healthy. And on the other hand, you have your hypochondriacs, like my mother, who has good health status, but constantly calling me, I got a sore throat. You think it's strep throat? Now with the pandemic, it's, oh, I have a headache. Do you think it's the coronavirus? So, you know, her self-concept of her health is wrong, but it's her self-concept. So a view of health is important. One of the most striking things that has happened, especially in recent years, I'm talking recent in the past 20 years, is media. As we know, bullying goes on in social media. People like to show only their best side for the most part on social media. All those Instagram pictures with the girls with the pursed lips and the perfect makeup. And that's not them on every ordinary day. That's not how they act for the most part. It has been shown that social media is linked to higher levels of loneliness, anxiety, envy, narcissism, and decreased social skills. We've noticed that, especially in the younger children nowadays, it's harder for them to learn person-to-person social skills because of media. And like I said before, it's causing distress in many kids. You know, you see somebody having this wonderful life on media, but in actuality, it's not that wonderful. But then you compare it to yourself, and of course, your self-image goes down. Another important aspect of self-image is relationships. When you have a problem relationship, it can lower your self-esteem, and it can also lower your confidence. Rejection causes problem with self-esteem, self-confidence, and how you feel about yourself. And when you get criticized, generate low self-esteem. That's important to do constructive criticism, and that helps not to lower self-esteem. Abusive relationships obviously have a hugely negative effect on self-image. It's oftentimes said, how come people don't get out of that relationship? Well, they feel trapped. Their self-image is that they're impotent to leave that relationship. And when you have good relationships, it's just the opposite. Improved self-concept. Somebody would see a really strong couple that are very happy together, and you can tell, and their self-concept is greatly improved. So there's a bunch of components of self-concept. As you can see, they all intersect to become one. So there's personal identity, body image, self-esteem, and world performance, and we'll go over each of those. Personal and social identity. It's the ability to distinguish individuality, age, race, culture, gender, and sexuality. It's a really good video that's posted on Blackboard on this, so I would take a look at that. Body image. Obviously, our body image is a huge factor in how we evaluate ourselves. So how does our body function? Are there any parts different or missing? Does it look right? Does it look like everybody else's? Appearance, you know, your body size, your hair, makeup, clothing, and that's very important. So a positive self-body image promotes concern for health and appearance, and the negative self-body image allows people to focus on minor illnesses or neglect their basic needs like dating and healthcare. Role performance. How do you carry out your significant roles? How society or other culture expects them to perform that role. So, you know, say, how do you carry out, if you're a mother, that role? What does society say about that? Different people have different aspects, whether you should be a helicopter parent or let them go free, or there's all different ways to carry out your role, but it's how you feel about your performance of the role. It's hard when you get a new role, like a new job, new child, and care for a loved one. It changes your self-concept, and sometimes for the good, sometimes for the bad, but it changes your self-concept. Self-esteem, it's your judgment of a value of your personal worth. You get emotional appraisal, and it's been greatly affected by your views, either positive or negative. Stressors challenge a person's adaptive capacity. So if you can't adapt, failure to adapt may lead to a negative self-concept. I think this cartoon illustrates it pretty brilliantly. Things that may alter self-concept, identity stressors. These are stressors that occur at any time during the lifespan, but particularly during adolescence when they're trying to find themselves. So you have that identity, self-concept stress to get over. Body image, your appearance, structure, or function of a body part, that can be a stressor for people. And self-esteem structures can vary with developmental age. So chronic illnesses, injuries, surgeries, change in lifestyle patterns, all affects a person's sense of self-worth and self-esteem. Role performance. So these can occur in relationship to transitions that occur when parents, children, spouses, family members die, or when people move, marry, divorce, or change jobs. And they can also occur when moved from a place of wellness to illness. So you have role ambiguity. Involves unclear role expectations, which makes people unsure about what to do or how to do it. Role overload, I think you might feel some of that right now, involves having roles of responsibility that are unmanageable. Especially this can happen when you get sick. Role conflict. It's when a person has to assume two or more roles that are inconsistent, contradictory, or mutually exclusive. And then your role strain, your self-esteem structures can vary within developmental stages. Here are some of the qualities of a high self-esteem: positive relationship, you have goals, good attitude, you know your strengths, you know your own skills. Sense of humor is very high on that list. Resilient, pride in your success, which everybody should take part of. And your qualities for low self-esteem: feel unfulfilled. Anxiety and depression are symptoms of low self-esteem. When people don't look you in the eyes, you're not taking care of yourself. A person who's overly critical also has low self-esteem. And sometimes people can't accept praise. Those are all signs of low self-esteem. So when caring for patients, nurses need to take care of personal inventory of their own feelings, expectations, and attitude. Your nursing care significantly affects the patient's body image. You should be aware that both your nonverbal and the words you use can have a direct positive or negative on a patient's self-perception. That's why we teach you therapeutic communication. You got to know your own feelings about ideas, values, expectations, judgments, and prejudices. I put a short fun video from, it's nothing that you need to know, but it's just from a musical called Avenue Q, called Everybody's a Racist, which is true, and to some extent. Your personal self-concept, you need to take your own personal inventory and drop your feelings and understand the patient's feelings. So with patients, you try to be positive, try to build a trusting relationship, and be aware of your facial and body expressions. So ultimately, as nurses, we want to prevent, identify early, and implement appropriate treatments for stressors of that patient. So on your nursing assessments, regarding self-concept, you observe, you watch for behaviors that are suggestive of altered self-concept, especially nonverbal actions. You assess their coping skills, their support systems, what type of relationships they have, and you have to take into consideration their cultural background. And you ask how they feel about their role performance, their body, their identity, their self-esteem. So You say things like, what do you do when you're experiencing personal problems? Who do you call when you're having problems? How effective are you carrying out your role? Things like that help you to better understand your patients so you can give them the appropriate care. There are 3 nursing diagnoses that I need you to look up in your Ackley book and just become familiar with. Disturbed body image, it's obvious, it's confusion on mental picture of oneself. You have situational low self-esteem. You can get a negative perception of yourself in response to the current situation. Let's say hospitalization can give you the low self-esteem while you're in there not being able to take care of your family. And situational low self-esteem, risk for vulnerable to developing a negative perception of self-worth in response to current situation. And that may compromise self. So that's about it on self-concept. We need to take care of ourselves first. Try to build a good self